May is American Stroke Month, and every 40 seconds, someone in the United States does suffer from a stroke.
Dr. Michael Manchak and Dr. Alexander Drofa are here from Stanford Stroke Team to talk about how we can take action to prevent strokes and also understand the signs of a stroke. Gentlemen, thanks so much for being here. We appreciate it. So let's start with the signs of a stroke. If you're out and about and you see somebody possibly having a stroke, what are you looking for and what should you do?
We want people to remember be fast. So B stands for balance, so sudden loss of balance or coordination. E stands for eyes, if you lose vision in one or both eyes suddenly. The F stands for face, so if somebody looks and sees that their face is drooping down. A is arm, so weakness of the arm, drifting down to the arm or the leg. S is for speech, so slurred speech, trouble getting your words out or trouble understanding people. And T is probably the most important of all, time to call 911. Most of the life-saving treatments we have available for stroke are time dependent, and we want people to call 911 and get to the hospital right away.
FAST used to be the acronym, now it's Be Fast. So kind of explain to people why you guys added the balance and then the E, the eyes.
So we were missing a lot of strokes that affect the balance center of the brain and the brain stem. So we added the B and the E to try and broaden our public education, because we were missing some of these strokes and they ended up being very debilitating strokes, and people didn't get that treatment in a timely fashion.
It seems to be much more prevalent to what's happening as of late as far as strokes that are happening. You just said a moment ago that we've got kind of the good housekeeping seal of approval over at Stanford when it comes to stroke care. So tell us more about that.
Oh yeah, absolutely. Stanford is one of the 3 advanced comprehensive stroke centers in the Midwest, 2 other being Mayo Clinic and University of Minnesota. So it's a great achievement for the state. It's a great achievement for the community. What this certification means, it tells the public, it tells the community that we met certain standards of our education for the staff, certain standards for the level of the complexity of the pathology that we can provide. Things like having 24/7 neuro-ICU coverage, 24/7 cerebrovascular neurosurgery, cerebrovascular neurology, pediatric neurology, pediatric vascular neurology. So all those things counted towards the certification. And obviously it took almost 3 years to get, and this is the most difficult certification to get for the facilities.
Now, once someone does recognize those signs, they call 911 and say, yep, we believe it's a stroke, and they come to you. You know, talk about the different treatments you're doing, the surgery too.
Oh, absolutely. Obviously, the most common type of stroke is ischemic stroke, and this is what this acronym relates to. About 80% of the strokes are caused by the occlusion of the vessels. And in this type of stroke, time is an essence. So those patients being transported to our facility as soon as possible. We know about those patients long before they come in, so we have all the surgical teams available. And what we can do, we actually can use a special techniques to go inside the brain vessels and open them up. And if it's not too late, that's why time is so important, we can reverse signs and symptoms of stroke. Another type of stroke is a hemorrhagic stroke. It's a bleeding inside the brain that can be caused by various causes, one of the most common being cerebral aneurysms. We can, again, either use the same techniques, go from within the vessels, or we can do a microsurgery and fix those vessels, or we can take the blood clot out. So all those things happening extremely fast, and all the systems of care being well arranged, very efficient at Stanford.
Wow.
So once let's say you're post-stroke, what are some things you should be doing to help prevent it in the future and just take care of yourself?
So once the patient is in our facility and we've done whatever initial treatments that we can for them, whether that's physically removing a clot, which is something that Dr. Drofa does with the procedure, giving them the clot-busting medicine that we can give people in their veins to open up the artery, or handle some of the bleeds in the brain that we talked about. It really comes down to focusing on that patient's individual risk factors. So blood pressure, cholesterol, diabetes, smoking, exercise, healthy eating, all the things that you can do that you can control. We can't control who our parents are in our genetics. We can't control how old we are, but we can control a number of stroke risk factors, and really working with the doctors and your regular doctor once you get out of the hospital to maximize all of that risk factor modification to assure that you don't become one of the nearly 20% of people that have a recurrent stroke in this country.
And some of those risks that you just talked about, you know, the healthy eating, the smoking, etc., you know, are some of those things we should do and really focus on before an event happens? Does that really help reduce your risk then?
Of course. Primary prevention is always better than secondary prevention, and so we want people to do all those good things before something bad ever happened. Unfortunately, a lot of the times people have come to us and it's a little too late. They've had their stroke, and all we can do is focus on moving forward. They need a lot of rehabilitation sometimes, so it's really key that they get good rehabilitation services with physical therapy and occupational therapy and speech therapy, and then working on all those things to make sure this doesn't ever happen to them again.
You mentioned family, so is genetics an important component of this? I mean, is that something that has a big impact on your probability of having a stroke? Or
There is a genetic component to some risk factors, cholesterol, blood pressure, that type of thing. But even in the face of genetic predisposition, again, if you're working with your regular doctor on maximizing all your risk factors, it shouldn't matter. You should take all the right medicines and do the right things.
Wow. I know you guys have mentioned time, you know, a couple of times this morning already. So what do you see when someone has gotten that help right away versus someone who might not have had their signs recognized right away? Is there a difference that you see as a surgeon?
Oh, absolutely. You know, if somebody comes to Sanford and during our workup for stroke that happens extremely fast, we found out that the brain has already died. There is nothing we can do. And unfortunately, it's not a surprise to see patients who do not survive massive stroke, or patients who are debilitated, end up in a nursing home. And this is one of the most debilitating disease. Contrary to this, it's very, very impressive when somebody comes to your operating room, not able to talk, not able to move right side, or unconscious, and after essentially a 10-minute procedure, they regain their function. It's almost a miracle. It's very, very impressive. Yeah.
We're lucky that it's here in our
Yeah.
community then.
thank you guys for the education. We appreciate it. So if people want to get a hold of you and reach out, phone number, website.
All of the above.
All right.
Just go to
Yeah.
Sanford Health, look for the stroke team website.
Thank you guys.
Thank you.
All right, stay with us. We're going to wrap her up right after this.